Hi, this is Dr. Johnson, the floater doctor. And I have with me graciously one of my patients who's agreed to do one of these interviews, and I haven't done one of these for a long time. And I really should, because showing the treatments and showing more treatments and talking about it and talking, that's fine and that's good and that's educational. But I think really the human interest side of this is really what people can relate to. And so maybe we'll just talk a little bit about that as well as the treatment results. So Dallas has come from Wichita, Kansas. And we should have our masks on, but we're in the middle of this pandemic. My office is still open. I'm still seeing patients. And he came, he put himself into an aluminum tube and flew over here with recycled air. So taking some risk, I guess, and to seek treatment for his floaters. So first of all, welcome.
Thank you.
And thank you. So tell me, just sort of like the brief, maybe the 30-second elevator pitch about your floater history, and more importantly, how it was, past tense, affecting the quality of vision and quality of life for you.
Well, I had a macular pucker on the back of my eye about 3 or 4 years ago, and it developed over time, and over about a 6-month time, I noticed it, went to a ophthalmologist. He said we could do a vitrectomy on it. And I said, because my vision wasn't that bad, I said, is there another option? And we waited about 6 months. And by that time, it had released. And then the stuff left behind was developed into this big linear floater on my right eye. And I started looking at it and looking for what are the alternatives? Is there a way to treat that? And after searching it, I came across Dr. Johnson's website about maybe within a year, and then due to timing and everything, I finally got to the point where I was able to come and visit the doctor and get my floater treated.
Good. And that was a couple days ago, was
Yes.
the first visit. And so a couple comments. What Dallas has experienced is a posterior vitreous detachment. So I can't prove it, but probably what happened was this vitreous back layer here, like so, probably had partially separated and was still stuck onto the macula there. And that traction and that pulling was causing some visual problems. When he said that it released, it did pull away and didn't cause any problems with retinal holes or tears or detachments. And so this vitreous membrane came off the back wall here. Well, he is nearsighted naturally. And sometimes people who are very nearsighted, that membrane, instead of being perfectly clear or clear transparent sheet, will be a bit hazy. The most extreme version of that, or more common version, I should say, is a density that forms right around the optic nerve there. And when that pulls away, you can have a density right about there, and that's called a Weiss ring. He had an interesting variation, and in a few moments I'll show some of the treatment there. You can actually see this. He had not so much a Weiss ring, but almost like a sheet, like a dense, hazy sheet of plastic that is part of that membrane that came off there. So it's a variant of a Weiss ring, a little bit more unusual, but kind of that semi-translucent, hazy, plastic sort of membrane just suspended right there. So because it's tethered and suspended in that position, it's like trying to look through frosted glass. And I think he had described it as linear. Well, I saw it as sort of two-dimensional, but at times when it would rotate kind of on this way, it would appear dense and linear like that. So kind of an interesting variation. I don't see them all that often. I have seen them before. And a number of favorable things about that is that material, as compared to the cloudy floaters, it does respond pretty well to the laser treatment. It's just he had a lot of stuff.
So the first one will go something like that.
And so we did our first treatment a couple days ago, and you came back yesterday, bright-eyed and bushy-tailed and pretty happy, said it was about 70% better. And I think, so what happened was, I broke some of the tetherings that were holding it in place there. So at the end of that first treatment, I looked in there, and boy, it actually looked pretty good. I thought I was kind of winding down. Well, what had happened was a big part of the untreated part of it had just kind of fallen out of the way there. So about mid-treatment yesterday, having you flick your eye around, this thing came up and just kind of, oh, there it is, we got to go after that. So let's show some of that as well.
Okay, let's have you look down for a moment, and then back to the light again. Hold that. Oh, there we go. There's our junk. Okay, yeah, so it got displaced. There's still some, just completely moved out of the way. And this is not reformed stuff. This is just stuff left over from yesterday. I didn't see it at the end of yesterday's treatment. It must have just been sort of pushed and displaced out of the way. So we got a little bit of work to do still. Well, in some ways that makes me feel better. It's like, well, there's stuff to get here.
That's probably Mr. Snake.
Probably.
So once I had a better understanding of it yesterday, I just kept having you flick that up there and flick that up there and just really going after that. So the good news is you came back again today. We are on day number 3, third treatment. You're dilating right now. And where are we as far as what we've accomplished?
Well, like I said, I think we're 90 to 95% improvement over what I said. Now, what I did say was that, if he couldn't treat it, I could have lived with the way the floater was. It was a major annoyance, but it wasn't impairing my vision. But we're like at 90 to 95%, I think, improvement over what I was, and all I have left right now are just a few little specks and a few little odds and ends that he'll probably go in and try to clean up. But I'm very pleased with what's happened.
And if I heard you correctly, 90-95%, that's pretty good. And pretty good particularly for a procedure that many of my smarter colleagues says doesn't even exist. Like, we're still, I've been doing this for 14 years. The procedure's been around for about 25 years or so. And in a way, still kind of working in the shadows, where the professional organizations, the American Academy of Ophthalmology, the insurance companies like we were just discussing a moment ago, they don't really recognize this procedure. So it's interesting. I think the interesting dynamic is we have a smart gentleman here, a lot of my patients, who the burden and the onus is on you to have to do your own research, right? And oftentimes going against your doctor's recommendations, or I should say admonitions, not to have treatment. Your doctors did say maybe a vitrectomy or something like that, and that is an option, but...
Well, most of them had said, because I found out that you used a YAG laser, and I said, do you know anybody who does YAG laser for this kind of treatment? And they said, no, we don't know of anything. And I looked around Kansas and called a few different places and looked. The only other thing I had ever found was a reference in a journal article in about 2017 that was written that, hey, this new procedure with a YAG laser looks very promising. But I never found anybody else, at least in Kansas, that would do this,
right,
or anywhere else.
And there might be, and that's a whole another sort of conversation. But the short version of it is, the company that makes my laser is selling a lot of lasers, and they're promoting these doctors as floater treatment doctors. So maybe going to their website, you might find somebody who bought the laser. But as I try to be very clear about is, you have to be careful, because just because they have the laser, well, as they say, the laser doesn't treat the floaters, the doctor treats the floaters. And that's where I will say I have a lot of experience with this. And, with that experience, I think it leads to better decision making. Sometimes that means being better able to treat the difficult ones, but I think sometimes that means also knowing what not to treat and what to walk away from. And that's true of any good surgeon, knowing what to walk away from and not go walking in that minefield. So I'm both honored that you came out here during these interesting times, and I'm really pleased that we've made that kind of progress. In a few minutes, we're going to
So am I.
yeah, especially you. And it's just it's a really interesting dynamic, I think, where where people really have to kind of do their own research. And I do tend to see a lot of what I call problem-solving personalities. My patient base, great patient base, love my patients. They tend to be a lot of engineers, a lot of entrepreneurs, a lot of professionals, and these are people that I can kind of consider as problem-solving personalities. And I think they are the type that will say, even though my doctor said nothing could be done, well, I'm going to do my own research and kind of figure this out on my own. And the information that I put on my website, I try to, not to steal a phrase, be fair and balanced. Yeah, I try to be very transparent about that process, so that by the time somebody lands here, they already have a good understanding of what the procedure is, and certainly what the costs and insurance policies and expectations. I try to do all that in advance and provide that for you. Of course, I'm trying to bring patients to my practice. It is a business, but I'm also telling most of the younger patients nothing can be done. Probably nothing can be done, and that's again another video. So, anyways, I tend to talk a little bit too much. We should be interviewing you, but thank you for coming.
Thank you
I
for
had a few moments.
letting me come.
Yeah.
I'm glad I did. I'm glad I came. I'm very pleased.
Thank you, and that's a great testimony.